microbiology and I had a genetics course, but I got bonus points because I took a class in immunology and I took a class in parasitology. Just, you got to take what you like and what you're interested in. But if there's a school you like, I definitely would call them and see if they have any other suggestions. And then look online too as to what their requirements are, because a lot of them do have pretty extensive course requirements to apply to school.
What do you think the job outlook is like for physician assistants? Do you think it's like going to continue to increase or decrease or stay about the same? Like, is there a high demand for them? Like, as far as getting jobs, it's easy to get one right out of school.
Okay. I think, honestly, the way that our country's heading, there's a lot of physicians that are retiring. There's a lot of patients that aren't getting cared for. And with the Affordable Care Act giving more patients insurance, they want to see someone. And there's not enough physicians to see them. So I think there's a great demand for PAs. I know the last 5 years have been listed in the top 10 growing jobs on the Forbes list is of like the best jobs in the country. A lot of physicians aren't able to handle all the patients they have, so they need someone in that mid-level range that can see them. And so I think there's a great job outlook. I really didn't have a problem. I interviewed in 4 places straight as a new graduate from PA school. I interviewed in 4 places here, and none of them had ever even heard of my schools because I was from Florida. I mean, they just wanted a PA. And once you finish school, you take a certification exam. As long as you're certified, most physicians don't really care where you went to school. If you have that certification, they know that you meet the national standard and you're going to be a decent PA, and that's what they want. So I don't see that being a problem, really. Yeah.
Just to give an idea of how it's structured, how many PAs work under a physician? How many patients does he see?
Okay.
Or is it in your system?
Okay. That varies by state. Each state has different rules. In South Carolina, they just changed the state limits. So a physician can have 3 PAs under them here in South Carolina. I know where I was from in Florida, it was 4. But that's going to vary by state. Right now, because I'm brand new out of school still, I see about 15 to 20 patients a day. My physician probably sees closer to 30. But, if I have a problem or something comes up, we can totally, I'll help him out if he gets behind. He helps me out if I get behind. I'm the only PA under my physician right now. Most practices I've seen only have 1 or 2 PAs per physician. But I'm in a big practice. We've got 5 physicians and 6 mid-levels. So there's a lot. There's a lot of us there. Any other questions? Yeah. What are your questions? I practice on IRMO, South Carolina Internal Medicine. Yeah. Any other questions?
Any other questions? I have a question. So you were pre-med for 4 years, right?
Kind of.
Kind of? Okay.
I was kind of pre-med. I was a microbiology major. I really liked virology and viral studies, and so I kind of thought about pursuing research for a while and doing a master's or PhD there, and I did 2 years of research and realized that was not for me.
I gotcha.
It was genetics research. It was really interesting, but it was very stressful with all the grant writing.
Yeah.
And you didn't get to talk to many people other than the people in your lab. And I needed to get out of the lab. I couldn't handle just sitting in there with a microscope all day.
Did you ever consider like MD, PhD program? I mean, that's a lot of schooling. That's even more.
Yeah, that's a lot of schooling. And those are really tough to get into and demanding.
Yeah.
And for me, my husband got into medical school, and that played a part of it for me because I knew, he got into medical school. He's going to be a physician. He's not going to have a ton of time. If we want to have a family, I want to be able to be available. And one of the things I like about PAs is you can, because you're in demand and a lot of physicians want you, you can work with your contract, you can work part-time and still pay off your loans. And for me, that was a big selling point too.
I gotcha. So I guess like think about like people who are not sure about medical school now and they're like a junior or senior. Any good tips or advice in terms of like, should I go to PA school, or I mean they kind of devoted the past 2 or 3 years to pre-med.
Well, there's a lot of overlap because most of your pre-med courses aside from orgo and physics aren't really needed for PA school.
So no physics?
No. I know, I wish I'd known that beforehand. No, I mean, a lot of your pre-med courses are definitely going to help you when you apply to PA school. You might even get that extra credit. Like I got extra credit because I took physics too. So, I mean, it's not required for PA school, but it's not going to hurt you. It's going to contribute to your overall understanding better, and that's not a problem at all.
Gotcha.
If you're kind of wavering or you're still unsure and you're a junior or senior, see if you can find a PA to shadow or someone at least to talk to and get some some other perspectives, because there's a lot of stuff out there other than being a physician,
Mhm.
too. I know, it's a big commitment. So.
Yeah.
Yeah.
I know with physicians, like you said, you want to like be able to stay home and like have a family and that sort of thing. So you said with a PA that you can take time off and then go back. So I know with physicians you can't really like take time off, so you have to maintain your licensing and stuff.
Right. Well, I mean, we have the same requirements licensing-wise for continued medical education. You have to go to conferences, you have to read articles, you have to submit all that stuff. But you can keep your license up and be at home, or it's a lot easier to work part-time as a PA than it is to work part-time as a physician. You know, as a physician, you've accrued all this debt. You want to work 20 hours a week and have kids and stay home some too. That's really tough to do when you've got 150 in debt that you're trying to pay off. You know, and a lot of practices when they hire a physician, they want someone who's going to work full time and be there most of the office hours. And as a PA, you can come in and say, I only want part-time work. And it's a lot easier, I think, for them to work with you if that's what you want. Any other questions?
Questions?
No?
I guess I have one more question. I'm sorry, got a lot of questions. So with the changing medical field, and there's definitely a shortage of GP. Do you see like maybe PAs having more power in the future as a way of solving the shortage of physicians that's gonna happen in, I guess, 10, 20, 30 years?
Yeah. I don't know about more power. I think there's going to be more physicians to hire PAs to help them out with the patient flow.
Okay.
I mean, honestly, and a lot of PAs will tell you, oh, we did a mini medical school, we know just as much as the doctors. They don't. They don't. You can't learn that much in 2 years' time. But I think you can do a lot, and having that supervising physician there if you need it helps out. So I think the PAs are well equipped to handle the majority of what comes into your office. About 90% of the time, they can handle it no problem. And if you need a physician, you can grab them. But I don't think PAs need to practice on their own. I don't think that's
That's a
is that what you're
possibility.
asking?
Yeah,
I
that's
mean,
the question.
It's possible if they legislate and change the laws, but I don't think it's necessarily in the patient's best interest.
Okay, I got
Because
you.
we don't know everything. We did 27 months of schooling as opposed to what physicians do. You can't say that you know exactly the same.
I got
So,
you.
I think we need that little overhead in case you have one crazy patient that you need it for, something like that.
Okay, and then you say it's very easy to switch from one specialty to another for PA versus a doctor. I guess a doctor, if you have to switch, you have to go through the whole residency.
Yeah, you have to
Oh,
reapply
man.
to residency, do your residency. If you want to do further specialization, you have to do your fellowship all over again. And that's a lot if you want to change specialties. That for me was really nice as a PA. I could do internal medicine for a few years, feel real comfortable with everything in general, and then if I want to specialize, I can go into one field and just find someone to hire me. That's all I'd have to do.
Okay, so it's just some training and then, okay.
And a lot of it is kind of on the job. So, you find a physician
Okay.
who's willing to teach a little bit, and you can take some courses, you can read articles,
Oh, okay.
That's pretty much all you have to do. You don't have to do any further formal training usually.
Okay. How's pay compared to like physician? Sorry.
No, that's fine. It really depends on specialty.
I got you.
Your family medicine docs usually make 150 to 200 a year. Average for PAs is about 90 a year. So, I'm working 4 days a
That's
week.
awesome.
I'm a happy girl.
That's awesome.
I'm not going to kill myself to make a little extra. So I'm very happy with that. I have friends who work in dermatology, and those positions get paid a lot more. They're all making over 150 a year as a PA, which that's pretty nice. 2 years of additional school for undergrad, and you're doing really well. So it just depends on the specialty you're in. It depends on how long you've been there too. A lot of times, like my contract is annual, so I can renegotiate next year if I want a little more money, or a lot of physicians will give you a productivity bonus. So this is your salary for the year, but I also give you a percentage of what you bring into the practice. So that gives you a little incentive, maybe work a little extra, see that extra patient if they need to come in.
Okay.
So, I feel like pay is pretty fair. I'm very happy where I am. I'm not a physician. I don't expect to be paid as a physician, but it's pretty good, I think.
I gotcha.
Any other questions? Yes.
You took the GRE, right?
I did.
I just wanted to test.
Yeah, I took the GRE. I told myself I was going to study, and I did not. And so I wasn't thrilled with my score, so I retook it about 4 months later. And it's pretty much like the SAT. It's just a little math, a little English and have you write an essay. It's not bad. It's not bad at all.
So no MCAT for PA school?
No MCAT.
Woohoo!
Just the GRE.
So I'm talking about.
Yeah. Yes.
What are some like, basic differences between PA and NP?
An NP,
Yeah.
clinically speaking,
Yeah.
there's not much.
Really?
Clinically speaking, I do the exact same things as the nurse practitioners in my practice. We're on the same pay scale since we're in the same practice. It really depends on your physician. I was hired because my physician likes PAs better. You know, some physicians are just a little more biased. They like a PA better, they like an NP better. Maybe they had a horrible PA and they want to have nurse practitioners when they're not. It's really variable. Clinically, we do the same thing, we see the same patients. Schooling's a little different. Nurse practitioners have a harder time switching. When they go to school, they decide before they even start school, I want to see family practice. So that's what they're trained to do. They can't necessarily just switch over to, you know, pulmonology or, you know, something else as easily.
Okay.
Yeah.
Any questions? Okay. Well, thank you very much. Thank you.
I wrote my email up on the board there. If y'all have any questions, feel free to email me. Also, at some point in the future, I'm open to shadowing some shadowing. So if y'all have any questions, just send me an email, okay?
Okay. Thank you very much. Thank you.